Since the first TB case was discovered in Indonesia in the 8th century, TB transmission remains a threat for Indonesians. It is estimated 94 people fall ill with TB every hour, with 11 deaths with each passing hour. Where is our concern? Complementary to the Toast TBC campaign launched by the government of Indonesia, the Temukan or Find phase of Toast TBC campaign is most crucial part to stop TB transmission. However, its importance is often undermined. There are many people who are not aware that they are at risk of TB. Furthermore, limited knowledge available and misinformation in the public contribute to the continuous transmission and death caused by TB. Therefore, STPI invites the public to be wary of having cough symptoms for 14 days or more as a symptom of TB, especially targeting 15 to 34 years old who made up over 50% of the Indonesian population. STPI developed a simple message, the 14-1 Check TBC. 14 days of cough without relief, one solution to check doctor immediately. We spread the campaign through the various channels. The 14-1 Check TBC campaign reached beyond the target.
Ya biasanya sih saya biarkan sembuh sendiri aja.
Menjaga pola makan dan istirahat yang cukup aja. Lebih waspada dan langsung pergi ke puskesmas atau dokter terdekat.
Saya langsung cek ke dokter aja ya, kalau misalkan batuknya itu lebih dari 14 hari. Saya jadi lebih aware lagi nih. Saya mulai menghitung hari ketika mulai pertama batuk saya.
Jadi ketika lebih dari 14 hari, saya akan pergi ke dokter atau merekomendasikan orang-orang terdekat saya pergi ke dokter juga.
To realize TB elimination in Indonesia by 2030, let's amplify better TB awareness and encourage people to get checked immediately.
Tuberculosis kills more than 1.5 million people each year and affects millions more.
The TB was hereditary, but unlike other experts, Dr. Robert Hall, a German physician and biologist,
funding per TB case comes from out-of-pocket costs. On an average, individuals with TB in their households lose half of their income.
Because of COVID-19, TB will rank as the second leading cause of death from a single infectious agent after COVID-19.
The COVID-19 pandemic has taught us one powerful lesson.
Understanding of the diagnosis.
Some key mitigation strategies help India's counter.
The healthcare system.
All of us working, we became the frontline workers in working for COVID.
part of the COVID-19 on progress towards this target. Generally, low and middle income countries are disproportionately affected by TB.
TB all countries in operation. So in order to impact on TB control globally, we must
Saya mendukung sepenuhnya penyelenggaraan G20 side event on tuberculosis ini.
Because of this tuberculosis that has been spread over the world for more than 100 years.
Much has been talked about the impact of COVID-19.
As well as the of global and security in our field.
$10 million people fell ill with TB worldwide, with 2/3 of them reside in 8 countries.
Also in 2019, using the digital mindset of the COVID response.
The Indonesia G20 presidency wants to highlight that investment in TB is critical for patient outcomes, because we believe the more we invest in TB today, the more of people will get sick tomorrow. That's what we will do. Thank you so much.
Untuk kita bisa mengeliminasi TBC itu dibutuhkan dana, dan dana yang saat ini ada itu bahkan sebelum pandemi itu masih 50%. Bagaimana juga menerjemahkan komitmen di tingkat daerah sampai tingkat desa, sehingga pemimpin-pemimpin di tingkat daerah juga mempunyai komitmen di level yang sama.
Tuberculosis. Almost 1 million South Africans have died as a result of TB since 2010.
Ini juga menjadi perhatian dari negara G20 nanti, bagaimana investasi lebih besar lagi terhadap tuberkulosis.
I want to call all the G20 countries to further increase funding related to the infectious disease.
We all hope for a vaccine, for effective working vaccine. This is something that has to happen very soon.
My message to G20 leaders is to please invest in TB, because only if you do so can we hold on to any hope of ending TB by 2030.
Since the first TB case was discovered in Indonesia in the 8th century, TB transmission remains a threat for Indonesians. It is estimated 94 people fall ill with TB every hour, with 11 deaths with each passing hour. Where is our concern? Complementary to the TOS TBC campaign launched by the government of Indonesia, the Temukan or Find phase of TOS TBC campaign is most crucial part to stop TB transmission. However, its importance is often undermined. There are many people who are not aware that they are at risk of TB. Furthermore, limited knowledge available and misinformation in the public contribute to the continuous transmission and death caused by TB. Therefore, STPI invites the public to be wary of having cough symptoms for 14 days or more as a symptom of TB, especially targeting 15 to 34 years old who made up over 50% of the Indonesian population. STPI developed a simple message, the 14-1 Check TBC. 14 days of cough without relief, one solution to check doctor immediately. We spread the campaign through the various channels. The 14-1 Check TBC campaign reached beyond the target.
Ya biasanya sih saya biarkan sembuh sendiri aja.
Menjaga pola makan dan istirahat yang cukup aja. Lebih waspada dan langsung pergi ke puskesmas atau dokter terdekat.
Saya langsung cek ke dokter aja ya, kalau misalkan batuknya itu lebih dari 14 hari. Saya jadi lebih aware lagi nih. Saya mulai menghitung hari ketika mulai pertama batuk saya.
Jadi ketika lebih dari 14 hari, saya akan pergi ke dokter atau merekomendasikan orang-orang terdekat saya pergi ke dokter juga.
To realize TB elimination in Indonesia by 2030, let's amplify better TB awareness and encourage people to get checked immediately.
Tuberculosis kills more than 1.5 million people each year and affects millions more.
The TB was heredited, but unlike other experts, Dr. Robert Hall, a German physician and biologist,
funding per TB case comes from out-of-pocket costs. On average, individuals with TB in their households lose half their income.
Because of COVID-19, TB rank is the second leading cause of death from a single infectious agent after COVID-19.
The COVID-19 pandemic has taught us one powerful lesson.
Understanding of the diagnosis.
Some key mitigation strategies help India's outcome.
The healthcare system.
Monitoring the impact of the COVID-19 on progress towards this time. Particularly, low and middle income countries are disproportionately affected by TB.
TB in all countries in our region. So in order to impact on TB control globally, we must
Saya mendukung sepenuhnya penyelenggaraan G20 Side Event on Tuberkulosis ini.
because of this tuberculosis that has been spread over the world for more than 100 years.
Much has been talked about the impact of COVID-19.
As well as the root of global and security in our place.
$10 million people fell ill with TB worldwide, with 2/3 of them reside in 8 countries.
In 2019, using the digital mindset of the COVID response.
Indonesia currently represents wants to highlight that investment in TB is critical for patient outcomes.
Because we believe the more we invest in TB today, the more of people will get sick tomorrow. That's what we will do. Thank you so much.
Untuk kita bisa mengeliminasi TBC itu dibutuhkan dana, dan dana yang saat ini ada itu bahkan sebelum pandemi itu masih 50%. Bagaimana juga menerjemahkan komitmen di tingkat daerah sampai tingkat desa, sehingga pemimpin-pemimpin di tingkat daerah juga mempunyai komitmen di level yang sama.
Tuberculosis.
Almost 1 million South Africans have died as a result of TB since 2010.
Ini juga menjadi perhatian dari negara G20 nanti, bagaimana investasi lebih besar lagi terhadap tuberkulosis.
I want to call all the G20 countries to further increase funding related to the infectious disease.
We all hope for a vaccine, for effective working vaccine. This is something that has to happen very soon.
My message to G20 leaders is to please invest in TB, because only if you do so can we hold on to any hope of ending TB by 2030.
Since the first TB case was discovered in Indonesia in the 8th century, TB transmission remains a threat for Indonesians. It is estimated 94 people fall ill with TB every hour, with 11 deaths with each passing hour. Where is our concern? Complementary to the TOS TBC campaign launched by the government of Indonesia, the Temukan or Find phase of TOS TBC campaign is most crucial part to stop TB transmission. However, its importance is often undermined. There are many people who are not aware that they are at risk of TB. Furthermore, limited knowledge available and misinformation in the public contribute to the continuous transmission and death caused by TB. Therefore, STPI invites the public to be wary of having cough symptoms for 14 days or more as a symptom of TB, especially targeting 15 to 34 years old who made up over 50% of the Indonesian population. STPI developed a simple message, the 14-1 Check TBC. 14 days of cough without relief. One solution to check doctor immediately. We spread the campaign through the various channels. The 14-1 Check TBC campaign reached beyond the target.
Ya biasanya sih saya biarkan sembuh sendiri aja.
Menjaga pola makan dan istirahat yang cukup aja. Lebih waspada dan langsung pergi ke puskesmas atau dokter terdekat.
Saya langsung cek ke dokter aja ya, kalau misalkan batuknya itu lebih dari 14 hari. Saya jadi lebih aware lagi nih, saya mulai menghitung hari ketika mulai pertama batuk saya.
Jadi ketika lebih dari 14 hari, saya akan pergi ke dokter atau merekomendasikan orang-orang terdekat saya pergi ke dokter juga.
To realize TB elimination in Indonesia by 2030, let's amplify better TB awareness and encourage people to get checked immediately.
Tuberculosis kills more than 1.5 million people each year and affects millions more.
The TB was hereditary. But unlike other experts, Dr. Robert Hall, a German physician and biologist,
funding per TB case comes from out-of-pocket costs. On an average, individuals with TB in their households lose half of their income.
Because of COVID-19, TB will rank as the second leading cause of death from a single infectious agent after COVID-19.
The COVID-19 pandemic has taught us one powerful lesson.
Understanding of the diagnosis.
Some key mitigation strategies help India's outcome.
The healthcare system.
Monitoring the impact of the COVID-19 on progress towards this act. Generally, low and middle income countries are disproportionately affected by TB.
TB all the countries in that region. So in order to impact on TB control globally, we must
Saya mendukung sepenuhnya penyelenggaraan G20 side event on tuberculosis ini.
Because of this tuberculosis that has been spread over the world for more than 100 years.
Much has been talked about the impact of COVID-19.
Today, well, the same information. So,
As well as the rules of global and security in our field.
The 10 million people fell ill with TB worldwide, with 2/3 of them reside in 8 countries.
Also in 2019, using the digital mindset of the COVID response.
the Indonesia G20 presidency wants to highlight that investment in TB is critical for patient outcomes, because we believe the more we invest in TB today, the more of people we can save tomorrow. That's what we do. Thank you so much.
Untuk kita bisa mengeliminasi TBC itu dibutuhkan dana, dan dana yang saat ini ada itu bahkan sebelum pandemi itu masih 50%. Bagaimana juga menerjemahkan komitmen di tingkat daerah sampai tingkat desa, sehingga pemimpin-pemimpin di tingkat daerah juga mempunyai komitmen di level yang sama.
Tuberculosis. Almost 1 million South Africans have died as a result of TB since 2010.
Ini juga menjadi perhatian dari negara G20 nanti, bagaimana investasi lebih besar lagi terhadap tuberkulosis.
I want to call all the G20 countries to further increase funding related to the infectious disease.
We all hope for a vaccine, for effective working vaccine. This is something that has to happen very soon.
My message to G20 leaders is to please invest in TB, because only if you do so can we hold on to any hope of ending TB by 2030.
Since the first TB case was discovered in Indonesia in the 8th century, TB transmission remains a threat for Indonesians. It is estimated 94 people fall ill with TB every hour, with 11 deaths with each passing hour. Where is our concern? Complementary to the TOS TBC campaign launched by the government of Indonesia, the Temukan or Find phase of TOS TBC campaign is most crucial part to stop TB transmission. However, its importance is often undermined. There are many people who are not aware that they are at risk of TB. Furthermore, limited knowledge available and misinformation in the public contribute to the continuous transmission and death caused by TB. Therefore, STPI invites the public to be wary of having cough symptoms for 14 days or more as a symptom of TB, especially targeting 15 to 34 years old, who made up over 50% of the Indonesian population. STPI developed a simple message: the 14-1 check TBC. 14 days of cough without relief. One solution: to check doctor immediately. We spread the campaign through the various channels. The 14-1 Check TBC campaign reached beyond the target.
Ya biasanya sih saya biarkan sembuh sendiri aja.
Menjaga pola makan dan istirahat yang cukup aja. Lebih waspada dan langsung pergi ke puskesmas atau dokter terdekat.
Saya langsung cek ke dokter aja ya, kalau misalkan batuknya itu lebih dari 14 hari. Saya jadi lebih aware lagi nih. Saya mulai menghitung hari ketika mulai pertama batuk saya.
Jadi ketika lebih dari 14 hari, saya akan pergi ke dokter atau merekomendasikan orang-orang terdekat saya pergi ke dokter juga.
To realize TB elimination in Indonesia by 2030, let's amplify better TB awareness and encourage people to get checked immediately.
Tuberculosis kills more than 1.5 million people each year and affects millions more.
The TB was hereditary. But unlike other experts, Dr. Robert Hall, a general physician and biologist,
funding per TB case comes from out-of-pocket costs. On average, individuals with TB in their households lose half their income.
Because of COVID-19, TB will rank as the second leading cause of death from a single infectious agent after COVID-19.
The COVID-19 pandemic has
very soon. My message to G20 leaders is to please invest in TB, because only if you do.
To all participants and delegates, I would like to again invite you to come to the rooms. We are going to start the meeting soon. Once again, I would like to invite all the participants and delegates who are still in the outside to enter the room. We are going to start the meeting soon. Okay. Good afternoon, ladies and gentlemen, distinguished guests, and honorable speakers. Welcome to the Investing Right, Investing Now to End TB, a side event of Government of Indonesia, Government of Poland, in the collaborations of Stop TB Partnerships and Stop TB Partnership Indonesia. It is very great for all of us during the high-level week. We can attend and gather in here together to talking about things that we want most. The world free of tuberculosis. The side event will provide us a platform to discuss and the need for impactful investment in efforts to eliminate TB by 2030. This event is also proposed to deepen understanding and strengthen the cooperations and collaborations among member states, stakeholders, and partners as means to achieve the universal health coverage and build resiliency on TB response. My name is Siva and I will be your MC today, and it is an honor to guide you through today's agenda. We are going to have three main agendas today: the opening segment, the main discussions of the panel discussions, and also a closing remarks. For the opening sessions, we are having the Executive Director of Stop TB Partnerships and also Her Excellency, Minister of Foreign Affairs Indonesia. To get it started, I would like to invite Lucika Ditiyu, Executive Director of Stop TB Partnerships, to give opening remarks. Lucika, the floor is yours.
Thank you. Thank you very much. I don't think it works, not that I care too much, because I can cover the room, but maybe it's needed or something. Is this okay? Good. So thank you so much, and Your Excellencies, thank you for being with us today here. And it's a pleasure to have all the colleagues here in the room. I have to say that I'm very happy and impressed that Her Excellency, the Minister of Foreign Affairs of Indonesia, is here with us, and you, Your Excellency, from Poland. This shows an incredible commitment, but also shows something that we all in the TB community want, to really go and share our TB stories with different audiences, because traditionally we are very successful in speaking, but unfortunately a little bit among ourselves. And the entire reason of the UN high-level meeting and the entire reason of this week is to really elevate the discussion of TB above the discussion with the ministers of health, to the level of ministers of foreign affairs, ministers of finance, heads of states, and heads of governments. So it's music to my ear also to have Poland here, because also we observe that, unfortunately, I think leadership from high-burden countries seems to be sensitized to TB, but a lot of countries that are, let's say, with a higher income consider that this is a problem of others, not of theirs, when in fact it's a problem of everyone, because as we know, TB is an airborne pandemic, but it was not mentioned in the PPR discussions the other day at all. It's a disease that is spread through air, But in the entire discussion in a UNHLM on PPR, the word tuberculosis didn't come out of the mouth of any of the speakers. Incredible. Now, we are not here to discuss PPR and TB, even though that could be a very good topic, so maybe in the future we do together something about that. We are here because, as we said, we have the UN high-level meeting, but also we have an important moment in our lives, first time ever, in which we are in a situation in which we can be part of an historical achievement, which is we can end TB. We will not go to zero, but we are able to drop the numbers low enough to have the hope that by 2030 we reach where we should be in what we define ending TB. We are at crossroads where different new tools, new treatment regimens, a potential new TB vaccine, as well as an engagement of different groups from the society, including private sector, and as well as survivors and communities and a wide range of partners, we can make a difference. But what we need for that, we need two things. We need the attention and the awareness about TB, and we need the resources. And I have to say that it is maybe because of the background of His Excellency, the Minister of Health of Indonesia, being a finance person. Is it maybe, Madam, because I understand you care about health of people of Indonesia, that Indonesia actually took a very strong stand on financing about tuberculosis. And as we know, we even had special discussions around the G20 when Indonesia was the president about financing for TB. And we want to continue that conversation because it's very easy to say put money into a disease. There are many diseases. And it's very difficult for the government to really carve parts of the budgets. And that's why investing in a smart way, that's why making sure that the investments can be used in different ways and covering different diseases or multiple diseases will make a big difference. Thinking of investing in or having innovative financing tools to really secure the financing. I know Indonesia, together with the World Bank and the Global Fund, we were all pushing for having this kind of engagement together, a smart way of multiplying the money, in addition to the domestic contribution and increase in the attention locally. The last thing that I want to make is this. We have very clearly quantified how many billions are needed per year for the next 5 years. And it's not very little. Only for research is around 5 billion a year. So that's just the research part, and that's without rolling out any vaccine and so on. So it will not be easy to find this money. It's not easy to find the money to roll out the new tools or to procure them. But maybe there are ways to think in a smart way in which, as I said, TB is an airborne disease. You procure diagnostic equipment that helps TB but helps many other diseases. It's an investment that actually strengthens the system in the country, as well as for example, primary health care and so on. So smart thinking about TB, and I hope that from the speakers we will hear about that, smart thinking about response to the TB and the investments that we make, as well as a sort of collective, ideally, responsibility towards the health of people is what should be needed. I hope that tomorrow during the UNHLM, the interventions from the member states will highlight commitments and as well as financing commitments. And I really hope that we will all come and use the political declaration for the future in quantifying how much we deliver and how much we are left behind. We are leaving behind. So with this, I want to thank very much, and I will give back the floor to you, Siva. From Stop TB Partnership, we are extremely pleased to be here. And I just want to say a small thing. We are very happy with our collaboration with our colleagues from Indonesia. And the leadership, Indonesia is like, I'm sorry to say, is not because there was amazing food served. It's because it's a reality. Indonesia is like a flower blooming. DG Max, well done. Minister Budi is not here, but I'll tell him. Thank you.
Thank you very much, Lujika, for always providing insightful remarks. Now it is an honor for us. We are having the Minister of Foreign Affairs of Republic Indonesia in here with us. So I would like to welcome Her Excellency Ibu Retno Marsudi to provide welcoming keynote speech. Just like this.
you can see me, right? Yes. Well, thank you very much for inviting me in this meeting. It's a very important meeting. The executive director mentioned about let us close the gap between words and deed. And usually during the high-level weeks of the UN General Assembly, there are so many words. Now it's time to action. It's time to act. I care about health. I care about TB, not only because I'm a foreign minister. There is a close link between health and foreign policy. But on top of that, I am a mother. I am a grandmother. And one of my sons is also a medical doctor. So that's why when the Minister of Health asked me to open this very important meeting, immediately I said yes. And you know, to travel from the UN headquarters here, the traffic jam is very good. So the Health Minister of Poland, Excellencies, colleagues, and ladies and gentlemen, tuberculosis remains an urgent danger to the global society. 1.6 million people died from TB annually, making it the second leading infectious killer after COVID-19. TB creates a systemic effect on the society, damaging social stigma, hindering employment opportunities, and threatening family cohesivity. TB also represents global inequality as it grows more rampant in developing countries. And this year, during the high-level UNGA, we heard clearly, loudly, about the interests and the voices of the Global South and the need to address the voices and the interests of the Global South. So today I will outline 2 areas for us to work together to end TB. First, breaking the vicious cycle between TB and poverty. TB and poverty creates a deadly vicious cycle. Poverty is a breeding ground for TB, and TB impacted societies will fall even deeper to poverty. So ending TB is an investment to development. Investment to development. A cured household can regain 50% of their income loss to refocus on productive economic activities. So we must help vulnerable societies to break out from this cycle by ensuring community resilience, improving access to health care, and increase cultural awareness. The second point that I would like to share is on the importance of collective investment for new vaccine development. Breakthrough development on TB vaccine should be our common goals. A recent study by University of Harvard mentioned an effective new TB vaccine in low and middle income countries could lead to billions of dollars of potential health and economic benefits. Again, it is a very important investment for the future. And the COVID-19 pandemic has taught us that shared sense of urgency may lead to benefiting results. And we must work together to ensure the same urgency for TB. Excellencies, colleagues, ladies and gentlemen, the world awaits to the day when we can finally call TB a relic of the past. We must work together and we must act together. We must act now. And I thank you very much.
Thank you, Ibu Retno, for providing us an insight about the importance of global collaborations. So before we are moving forward to the main discussions, we are going to have a photo sessions, but apologize due to limited spaces and time. I would like to only invite the speakers and also the panelists and moderator and as well the Minister of Poland. So please come to the front to have a picture together.
No, thank you. What we do is we push.
Yes.
How many panelists so we can arrange?
Yes.
Where to stand, where to sit?
Yes. Minister, you're here.
Yes.
Did you are here? We can take a seat. You want us to take a seat? Yes.
Oh, sit.
Sit.
All
Yes.
right.
And the panelists will be behind.
And the panelists can stand
come
behind. Okay.
Okay, setting to it. Okay. At my cue, 1, 2.
And 3.
So far,
Can we take a moment?
take a moment.
The Minister
of
of
South Africa. South Africa. Please joining to take a picture, Mr.
Please. Right? Right on time.
Okay, everybody ready? 1, 2, and 3.
Okay, thank you very much.
Thank you very much.
Yeah. Oh, yeah. Yes, you can next. Yeah. Oh, yeah. It's okay.
So, ladies and gentlemen, we are going to moving to our main discussions, which is the panel discussions that going to be led by Ibu Nurul Untungan, Executive Director of the Stop TB Partnership Indonesia. Ibu Nurul, I would like to invite you to come to the front to lead the sessions.
Thank you so much. Thank you so much, High Excellencies, distinguished speakers, Teresa and Luchika. Yes, we have a good problem today that the space is a little bit crowded. Again, thank you so much for attending. So in today's discussion, we will talk and discuss about how we've been investing in ending TB and how we can strengthen the collaboration efforts. And it's not just about how much we've spent or how much we need to spend, but how we spend our resources, how we can strengthen it, and direct the collaborative efforts to be strategic and to be effective in our investments to ensure it will get us where we want to be in upcoming years. So without further ado, I will invite our panelists. We will have about 30 minutes of discussions, and I will give the opportunity to our discussants today to provide their responses. And if we have some time left, then we will also have question and answers. So please allow me to introduce our distinguished panelists today. Dr. Norbert Ncheka, the Chief Director of TB Control and Management in the Ministry of Health from Republic of South Africa. Please kindly take your seat. Dr. Maxi Rain, Dr. Maxi Rain Rondonuwu is the Director General Disease Control and Prevention from Ministry of Health of Indonesia. And Dr. Katarzyna Drazek-Laskowska, Director, International Cooperation Bureau, Ministry of Health of Poland. Mr. Timur Abdullayev, the Board Member of TB People Global from Uzbekistan. And of course, the last but never the least, Dr. Teresa Kasaifa, Director of WHO Global TB Program from the World Health Organization. So we have 5 panelists today, and we have about 30 minutes. So I will ask the questions to the first 3 speakers from the member states, to Dr. Norbert Mcheka and Dr. Maxi Rain, as well as Dr. Katarzina. Would you kindly share learning from the past 5 years, including during the pandemic time? What do you or your country see as the strategic investment to accelerate TB elimination? And after the UN HLM on TB this week, what do you foresee as the top 3 investments that the world need to do in the next 7 years if we want to end TB effectively? I would give the opportunity to you first, Dr. Norbert.
Okay, yeah. Thank you so much for this very important question. Over the last few years, post-COVID, what we've really learned has been that education is powerful. We can't leave some people behind. We really have to communicate. I mean, you could see during COVID pandemic, everybody could hear words like epidemiology. I mean, you hear it, you normally hear such words in the public domain. But what we've also focused on in South Africa has been testing more. The question of testing, we put a lot of emphasis. We're very worried that we saw a 20% decline in terms of case finding and notification. And we spend more money. In fact, we've been aiming at testing extra 1 million people using molecular tests every year. Last year, we managed to test in a region of 2,600,000 tests, which was really a big thing, because prior to that, we had the highest went was 1.9 million. So it was a big decrease, but we also saw improvement in terms of finding more people, although not too big like we had expected, but we surpassed our target. We managed to do more than the targets that we had placed. So that has been really very good in terms of finding more people, investing in new tools, but also what we started to do was to stop the traditional approach of screening everybody before we test. We identified high-risk groups that will be tested regardless of symptoms, because our HIV is really what is driving the TB epidemic. Because we got in the region of 50%. It's coming down. It was 60%. It's now around 50%. So we started to test HIV, people living with HIV once a year, regardless of symptom. We're not really testing them all yet. It's work in progress, but we see a lot of benefits. We also test people who have been recently treated. We had studies that have shown that mostly 1 year after treatment, a lot of people, those who come back, that's a period where they relapse. So we try, particularly with the drug-resistant TB patient, we test them post-treatment. And also we try to double effort in terms of treating close contact of those who are, TB confirmed. In the past, we had to screen, sometimes observe, wasting a lot of time. So when we test these categories without, symptoms, it's very helpful. But also use of urine LAM, artificial intelligence in terms of chest radiography, all those investments have shown that, they're really cost-effective. 2 most effective, cost-effective interventions been trying to find people, but also linking them to care. There've been massive success in finding, but linkage to care is really work in progress. I think it requires more efforts moving forward. So those are the key lessons that we learned over the last few years. Thank you.
Thank you, Dr. Norbert. And so I see priority, making the priority for finding people and to find the most cost-effective way to do it. And maybe for the next one, what do you see as the top 3 investments that maybe South Africa need?
I think moving forward, the top 3 investments should be getting more people. We need to accelerate testing, more tests, cut down the costs of testing, improve linkage to care. What we're trying to do is deliver SMS to each and everybody who get tested for TB within South Africa. The challenge we have is that not everybody provides the correct cell phone number. It's very interesting because we're told that in the pregnant mother system, they give more numbers, correct. But for TB, we haven't managed to convince the people to give us all the correct numbers. So if we could deliver those SMSs, regardless of whether results are positive or negative, this is crucial. And of course, TB vaccines. The challenge with TB vaccines is that our TB investment case has really not said much about TB vaccines because there haven't been much effort around that. But I personally think that apart from effort in diagnosis and leakage to care, TB vaccines are critical. But all this will work if we have better systems, because if you don't know where you are, it's very difficult to even find out when you've reached your destination. So data systems will really cut across these 3 interventions. It will be very helpful to help us moving forward. Thank you.
Thank you so much, Dr. Robert. And I will give the opportunity to Dr. Maxi.
Yeah, thank you. Yeah, I think that is a good question. Yeah. For Indonesia, the TB control strategy, Indonesia 2020 to 2024, we need to invest across for success strategy and implement their activity in order to achieve the national target. However, the cost estimation for TB intervention and program in our revised plan for 2020 to 2024 and interim plan for 2025 to 2026 shows that the biggest budget needs our strategy, increasing access to high quality and patient-centered TB diagnosis and treatment services. The strategy includes implementation in both public and private providers. The highest need is TB prevention, diagnostic, and TB treatment and care, which include procurement of diagnostic tools for laboratory testing services, the procurement of first-line and second-line drugs for adults and children, and for TB prevention. However, for the second strategy to be implemented optimally and sustainably across public and private sector, we develop TB innovative financing mechanism. This health financing activity primarily focus on performance-based financial incentive to both public and private primary healthcare services to encourage and improve their contribution in notifying TB cases and increasing treatment success rate. We currently implementing this innovation in 6 districts, increased treatment success rate, and with high TB burden across Java, Sumatra, and Bali Island. It consists 3 additional incentive for primary healthcare provider. The first incentive is for diagnostic, given for chest X-ray examination among TB suspect whose sputum rapid molecular test result is negative. And second is for treatment initiation given at the end of the 2-month incentive treatment phase. And third is for treatment completion given when the treatment evaluation is cured or complete. For top 3 investment in Indonesia, the first is to invest in TB research and development. The effective technology also need to be implemented at scale. We need to mobilize resources to fund the development of more effective TB vaccine, rapid and accurate point of care tests, and for safe and shorter regimen. In order to do this, we need to foster multi-country collaboration for undertaking TB research and development for new tools, including prevention of TB diseases infection. This is very important because everyone have the right to enjoy the benefit of scientific advancement, especially people who are not affected by the disease. Yeah, and the second priority investment needs to be for primary healthcare and health system strengthening. And the third, since Indonesia is governed with the decentralized approach, we need to engage with the subnational government to improve the subnational planning and budgeting in resource mobilization with domestic resources. Thank you.
Thank you so much, Dr. Max. And thank you for providing resonating from the Dr. Norbert about the importance of diagnostic and treatment, investing on that, but also investing on the primary health care and health system strengthening to overall increase the effort to end TB. And Dr. Katarzyna, we'll be happy to hear about your thoughts about how Poland see about investment to end TB and what would be you see as a very strategic investment to end TB globally in 2030.
Yeah, thank you very much. Excellencies, ladies and gentlemen, dear friends. Today, as we gather a shine to spotlight us on sustainable investments and in an integrated healthcare system to combat tuberculosis, with a special focus on the resources allocated to tackle this grave issue, I would like to share with you some comments on Polish priorities and experience. First and foremost, let me emphasize the critical need for consistent and stable funding of aspects of tuberculosis prevention, early detection, state-of-the-art diagnostics, treatment, and, of course, very important, social support for those affected by this disease. We must ensure universal, stigma-free access to prevention, early diagnosis, treatment, and care for both tuberculosis and MDR tuberculosis. We need to implement outpatient and people-centered models of service delivery to make this care more accessible and patient-friendly. Moreover, we need to work closely across nations to address TB issues among refugees and jointly monitor drug-resistant problems. Let me highlight the excellent cooperation between Poland and WHO in these fields. The WHO has been instrumental in providing funding for the treatment of individuals with drug-resistant TB, particularly refugees from Ukraine. As an example, I would like to share the success story of our joint initiative, the MDR-TB Emergency People-Centered Response in Poland. This project serves not only to the Polish patients, but also to refugees from Ukraine. Our goal is to deliver high quality, free diagnosis, free treatment and care for multi-drug resistant tuberculosis, with an emphasis on outpatient settings. We have embraced digital health solutions to enhance treatment adherence and have intensified targeted active cases finding among high-risk populations. To further our efforts, we have launched educational campaigns for healthcare professionals and established a dedicated hotline for refugees. Poland strongly supports keeping the TB team on high on the political agenda. I think that this is really, really important. We believe it is imperative to remind tirelessly the progress made so far by all of us. The existing challenges and strategies to overcome these barriers. One of the priorities of Polish candidacy to the WHO Executive Board membership is fight against TB. And today I declare that recommended Polish EB member, if elected, will advocate this issue during her term in the board. As a sign of our commitment to TB case at the margin of the latest WHA, Poland organized, with the support of WHO, especially Teresa and her team. Thank you again for that. The meeting, the side event entitled On the Road to the Second UN High-Level Meeting on Ending TB, Progress and Challenges. We are very happy we can co-sponsor also this side event. And I wish to thank the government of Indonesia for this valuable initiative. Thank you very much for that. Sustainable investments in integrated healthcare systems worldwide are not solely about monetary support. They symbolize our commitment to ending tuberculosis, our dedication to providing compassionate care, and our resolve to collaborate closely with global partners such as the WHO and other public health oversight bodies across the globe. Together, we can turn the vision of a world free from tuberculosis into reality. So, to make long story short, our priority investments, in my opinion, it is first of all, equal access to early detection and diagnosis, innovative treatment, and I think that the most important part, stigma-free care for TB and multi-drug resistant TB. Thank you.
Thank you so much, Dr. Katarzyna. And I think I will provide the next questions to Timur. You said yesterday, Timur, that you survived TB twice. It failed to kill you twice, you said last night. And we've been hearing a lot about the importance of providing access for treatment and also access for early diagnosis. And challenges still remain around the world. What is your perspective on actually implementing it in the next 7 years? What are the challenges and the opportunities And what do you see that how all of these investments will yield a significant difference for people affected by TB?
Thank you very much for the question, and thank you very much to Indonesia for organizing this event. I really like how Indonesia is actually being the leader in the fight against TB, and it's amazing. I really hope to see the club growing, the club of leaders. Or is it called the Coalition of Leaders?
Yes.
Good.
Club.
It's going to be a very elite club, let's be honest. In terms of the community role in making sure we do end TB by 2030, and yes, we will end TB by 2030. That could be next year's World TB Day slogan. And basically, the community is this, you may have this not very pleasant but very good friend who's like very honest to you, sometimes like too honest, sometimes so honest that you hate him or her, but still it's actually your best friend because that friend never lies. And that's us, that's the community. We are that friend, maybe your best friend, but not necessarily the most loved one. You see, we can be very unpleasantly direct. For instance, I will give an example. In 2019, in Jakarta, Stop TB Partnership had its board meeting. And it was greatly organized in collaboration with the Indonesian government and with the Stop TB Partnership. And at some point, actually, there was a question raised by someone called Timur Abdullayev. The guy was a board member at the time. And he actually asked, why there is no community seat on the board of the Stop TB Partnership Indonesia? And my question is, since 2019, is there a board for people affected by TB on the board of the Stop TB Partnership Indonesia? And you see, that's also something we do. I'm supposed to be answering your questions, and you see, I'm asking you a question. That's also something, we're full of surprises. The community we're amazing, seriously, amazing. And we will definitely follow up on the question about the board. Right now, we do have more than enough reasons to know that the role of the community in ending TB is actually very important, because we're passionate. You see, you said that TB tried to kill me twice, failed pathetically, thanks to the Global Fund, thanks to my country's healthcare system, and thanks to people who were actually helping me not to get dead. And so TB failed pathetically. Now I'm full of anger because I don't want it to kill others. So this passion is not going anywhere. It will be there. And that's the reason why community is such an important resource. I know that it may be, some people may think it's not really right to say it, but in military terms, a motivated soldier is times more effective than the one who is not motivated. And we are motivated where, the community is like that. We are not going to stop. And that's another thing that makes us a good friend, a very resourceful friend. And there is one thing that I have this theory about, how the community movement is growing. And it starts with one person, sometimes, one drop in an ocean. And then that drop somehow invites other drops, and that's how a network is born. So imagine it can be actually a very big network Imagine a lot of water in one place, like a reservoir. And that's a network. What we are trying to create in TB people, we're trying to create a movement. And the difference would be that that water is no longer static. It has a vector. And movement, think about mountain, river. It can move rocks. It can move mountains. Well, we do have quite a mountain to move. We do have some time by 2030. So as long as we really work hard, I think we can move that mountain. The important part is that you see that the river is always your friend and always your ally, no matter what. That river is moving in the right direction. In Indonesia, there is a great network of people affected by TB, which is growing into a movement. And that's a beautiful thing to see. That's basically, for me, that's a dream come true. So I really hope that together we will end TB in Indonesia and worldwide. And it doesn't matter whether the declaration is very loud about the role of communities. It's not. Whether declaration is very strong about the investing into community, it's not. Whether the declaration has specific targets for community strengthening and community growth, it doesn't. Whatever is wrong with the declaration, we will still use this declaration no matter what. We will use the good parts of it. There are some. And we also hope that countries will not be restrained by not necessarily strong language of the declaration and will move forward to ending TB, even if that goes beyond what the declaration is suggesting and demanding. Thank you very much.
Thank you so much, Sir. And I will also respond to your hard questions, and I give you two answers on that: direct answers and reasonable answer. The direct one is unfortunately not yet. We still have the same board at the moment. The reasonable behind that is because we're only changing, and yes, we already put TB community to be the high priority that we should put on our board. Yes. Thank you. And now I will give the chance for Teresa. Hearing all of these sharings from the member states and also from Timor, how do you think we can leverage global collaboration to actually realize those investments? We've been hearing about the importance of invest in treatment, medication, vaccinations. It's already out of our head now. But how we can actually leverage to make those investments happen?
Thank you very much, distinguished participants of this meeting. Your Excellencies, it's a pleasure to sit in front of you and with such a wonderful panel. Difficult question, but in general, our fight with TB is not an easy one, and we are quite experienced and ready to these questions. I would like to start with the story. Recently, I've received a gift from one of our TB activists from Kenya, my very good friend, and it was handmade. My photo on a wooden platform with the sign that Dr. Teresa Kasaiva invests to end TB. And I am keeping it in front of me. Literally, this was request, and I am taking this request seriously. And it means not only, of course, financial investments, a lot of investments and dedication, really to push progress. Progress is slow towards ending TB. And I would like to continue being positive, maybe even more positive than Timur, and saying that this is a really unique momentum for TB. And we have such an amazing leadership from the ministers of health and even presidents and countries affected by TB, but also dedicated to and committed to end TB. We have all the latest, based on evidence, tools, much better tools than even we had 5 years ago to diagnose, treat, and even 16 vaccines in the pipeline. We have excellent support, unwavering support from the donors. I see USAID representatives here, Global Fund, and this support will be continued. But of course, we need more, we need new actors, and investments are not sufficient. Just half an hour ago, WHO released at the press conference the latest updates on progress towards our targets from the previous political declarations. And they clearly shows that we've done all together, and member states, first of all, great work. And out of 40 million target, 34 million people have been treated. It's a huge progress. Despite of COVID, severe impact, this happened. But if you look at the subpopulations, of course, people with drug-resistant TB, especially children, are lagging behind. But I will not go into all these details related to TB preventive treatment. Just wanted to illustrate, we clearly understand, we monitor situation, and we have the instruments. We understand how to do, we understand how to keep ourselves accountable, and we have clear targets. So this is extremely important, this way to give us chance. Just yesterday we've launched, together with honorable ministers, it was a really historic momentum. First ever TB Vaccine Accelerator Council, with the commitments not only from the member states, but also from the investment banks, with the big players on the, not only on the health arena, but beyond. It also brings hope. So coordinated efforts of different players, real prioritization and political will, this should be invested really to push forward this heavy agenda. But if to look from, this is from global point of view, but I would like also to say a few about programmatic things. We should shift from our traditional way of doing business, and we should shift from our traditional mindset. When I'm receiving questions, so what could be one thing that you can do to really make the difference and push progress? There is no one thing. TB is complex disease, and there is no magic. There should be whole complex of care, beginning from TB prevention, proper and timely diagnosis, treatment according to the best available option today, and social protection measures and support. These all should be in place. And if we will not understand this, and while we will not understand this, we will not be able really to make the difference in the story of TB. Related to the declaration, just few things, and a huge thanks to our outstanding co-facilitators, Poland and Uzbekistan. They've done a really great job. And even at the press conference, we received question, why we have concrete measurable targets in the TB declaration and even financial targets. We don't have anything like this in UHC and PPPR. So this is big advantage. And other big health areas topics are learning from us, and we should build on this. And I think that there is recognition of community contribution. Of course, always there is space for the optimization, and we'll continue working together with you. But let's stay optimistic, as you proposed, Timur. And this is the only way to drive forward this agenda. Thank you very much.
Thank you so much, Now, I would like to invite our discussants to provide their thoughts. Okay. I think the mic is excited to hear that it's time for the discussants to talk and share their perspective. I will introduce 6 of our discussants to provide their thoughts. The first one, Nina. Nina Russell, the Director for TB and HIV Prevention from the Gates Foundations. Maybe for the discussants, we can just provide you the mic and you can share your thoughts. Yes, of course.
The room is deep, so if I don't go over here, nobody can see me. Good afternoon, and thank you very much to both the governments of Indonesia and Poland and Stop TB Partnership for organizing this event and for including me in the perspective of the Bill and Melinda Gates Foundation. We very much appreciate participating because these topics are ones that are a passion. You spoke about passion. They're a passion for us, just as they are for you, and a very high priority for the Gates Foundation, and are topics that we approach with urgency. And many of the things that were discussed earlier resonate with me and with our strategy and the work that we do in terms of the approaches that we're taking to support investments in tuberculosis. We do focus on driving innovation and developing new tools. I think most people know that. But we do so with an emphasis on end-to-end development and focus on ensuring access and delivery of new tools at an affordable price. That's absolutely critical. Otherwise, these tools are not going to accomplish what we want them to. So just briefly on the vaccine front, I think there's been a lot of discussion this week at various TB-focused events on the potential for the new M72 vaccine that we are funding and trying to drive forward with our partners at the Wellcome Trust and through our subsidiary, the Gates Medical Research Institute, which has in-licensed this vaccine from GlaxoSmithKline. And we're very excited about this opportunity and working towards anticipating the launch of the phase 3 clinical trial for that vaccine in early part of next year. And we're also very excited about the opportunity that's come with the WHO launch yesterday of the TB Vaccine Accelerator Council and our active participation on that and helping to really galvanize all of the leadership that's there to bring more attention, excitement, and innovative financing to tuberculosis vaccines. A few other things to mention on vaccines is that we do expect data later this year from a clinical trial that we're supporting looking at an existing vaccine, which is BCG, and boosting adolescents with BCG. We're doing a phase 2B clinical trial through the Gates Medical Research Institute, looking at BCG as an existing tool that could prevent new infections in adolescents. And this, of course, would be a much quicker and easier path forward and more of a policy question if we see that the prior result with this approach repeats itself. And so we do think that we'll have some answers on that by the end of this year. And we do also have a diversity of other vaccine approaches that we're very interested in because we can't put all our eggs in one basket. And we don't know if any of these vaccines that are out in front are going to work. And so we are continuing to push as well with other new approaches, including mRNA vaccine platforms, and are very excited that the work we're doing with BioNTech, as an example, is already in phase 1 in Germany and also going into phase 1 in South Africa as we speak for the first mRNA TB vaccine. Drugs and shorter, simpler, safe treatment regimens are also absolutely critical, obviously. And so this is another major emphasis for us, and we've put a big focus on bringing together partners both on the upstream discovery side as well as later stage development through the TB Drug Accelerator, working both with pharma and research institutions as well as the Pan-TB Consortium to try to bring together different drugs and try to accelerate the development of pan-TB regimens, and are starting to look now at long-acting formulations of TB drugs and think about if we could have a long-acting injectable and shorten the oral course to 1 or 2 months and then provide an injection, could we dramatically transform the course of treatment, which of course would impact accessibility and cost and all kinds of things. And then very quickly, diagnostics. We heard quite a bit of emphasis on testing and the need to really identify people and test them and link them to care. This is also a very significant focus for us. Looking, for example, at tongue swabs, building on the learnings from COVID as an alternative to all of the challenges with sputum collection, which we know is very difficult. Looking at low-cost, scalable point-of-care molecular tests, and also, of course, and there's been discussion this week about this as well, handheld x-rays with AI-enabled interpretation, all of which we think could help us dramatically transform diagnostics. And then lastly, delivery, because of course the new tools won't benefit us or anybody if we can't actually deliver them to people. And so really thinking about planning end-to-end from the very beginning about efficient delivery and access to new tools, the democratization of manufacturing, a big focus for us and it'll be increasingly going. And then, of course, advocating for increased financing and innovative financing mechanisms. So I'll end there, and hopefully I didn't exceed my 3 minutes by too much.
Thank you so much, Nina. Thank you so much. And I would like to...
Stay or sit?
You may pass the mic to our team and back to your seat. And thank you so much for sharing about the Gates Foundation's innovations approach and also implementations in making the vaccines on TBs happening. It's making every one of us very hopeful. And now we would like to invite Mr. Shadik Akasha, the President Director from Bio Farma Indonesia.
Thank you, Excellency, ladies and gentlemen. Respond to all speakers in this forum as every stakeholder involved in the funding of TB eradication program, including the government, UN, HWO, and other organization investment in development of TB vaccine. Bio Farma, as a company from Indonesia, will support all impactful investment from eradication tuberculosis. As a state-owned company and function as an agent of development to make contribution to the global health program, which include the first against tuberculosis. And we are, as a holding company, we have ecosystem that will contribute end-to-end healthcare system for TB eradication, including diagnosis, prevention, and treatment. We has exhibited in dedication to combating tuberculosis by manufacture of BCG vaccine, which is intended for both domestic and international needs. The BCG vaccine is the sole vaccine option for tuberculosis and has been employed over the century in battle against the disease tuberculosis. This vaccine has demonstrated efficacy in protecting children and infants against tuberculosis, as well as other illnesses caused by microbacteria. But on the other hand, according to the estimate of global mortality rate attributed to tuberculosis in 2021, approximately 10.6 million people infected. Significantly, the rest of multi-drug resistant and extensively drug-resistant tuberculosis has accelerated effort toward elimination of tuberculosis. Hence, there is an urgent requirement for the development of novel tuberculosis vaccine that can effective and efficient help for progression of TB illness. Bio Farma has undertaken a substantial and enduring commitment to advancement of a novel tuberculosis vaccine through collaborative partnership with the Contract Research Organization, CRO, based in Australia since many years ago. The development of TB vaccine is hindered by its inherent complexity. The prospect of developing and implementing novel tuberculosis TB vaccines in the upcoming decade is attainable, provided that the sufficient funding is promptly allocated from the research, development, and implementation. Hence, engaging in partnership with diverse institutions will contribute enhancing resilience to the national and regional context of tuberculosis eradication initiative. Forming a collaborative alliances with the developer currently engaged in advancement of TB vaccine research would serve as a prudent approach to expediting and implementation as soon as possible. Bio Farma is favored to investment in anticipate future collaboration in the field of tuberculosis testing prevention, and treatment. Investing right, investing now to end TB. Thank you.
Thank you so much. Thank you, Mr. Shadik, to share the work of Bio Farma in Indonesia as the manufacturer of vaccines, and we hope to see Bio Farma amazing role as well when the novel vaccine is here with us. Now I would like to invite Mr. Pandu Harimurti from the World Bank.
Thank you. Thank you for the opportunity, His Excellency. I'm thankful to the organizer for giving the World Bank the opportunity to be a part of this important discussion. And I'm delighted to be here to represent the World Bank Health Team at the global level, as well as I'm also wearing the other hat as a member of the World Bank Health Team at the country office. The World Bank continues to provide support at the global, regional, and local level as a joint effort to eliminate TB through its lending operations, analytics, as well as commitment to global efforts and partnerships. We recognize the importance and urgency of action to tackle TB and its impact to health, well-being, livelihood, and quality of life of people, as well as its economic impact on countries in terms of loss of productivity and premature mortality. At the moment, there are at least 4 specific TB lending operations with the amount of $1 billion. And in addition to that, there are other health system strengthening operations that have benefit for TB directly or indirectly in many other countries, in many countries, and with much larger value. Our investment to strengthen country health system that directly or indirectly benefit TB exists in all regions of the world. To help you illustrate one of the operations, or a couple of operations in Indonesia at the moment, supporting primary health care, includes the improvement of the use of data and information, integration supporting the integration of data system, and then also the Kegiatan social health insurance reform program, in which we are reforming provider payment, introducing incentive mechanism to providers, in the end will help TB program coverage. Other example is from East African Public Health Laboratory Network Project, in which we are strengthening public health labs that benefit TB. This is something that I think will be done in Indonesia as well. However, even after these efforts, there may be need to further scale up such financing to address the identified financing gaps. A key role that the bank intend to continue playing is that how we can optimize our convening abilities, knowledge initiatives, and financing to leverage domestic resources, as well as increase the value of money, the value for money of the domestic financing, as well as from the external financing. Addressing the unmet needs for TB is a huge task and will require us to do things differently. And we as a financing organization will keep improving. But first, I would like to call that we need to enhance collaboration among international development agencies and amplify and synergize with each other rather than fragmentation and duplication. Secondly, we will need to work more and more within health systems analyze available information, we collect and use it to innovate better design. Interaction with clients such as Indonesia, where there is a clear vision and timeline, and pushing us to deliver better and faster, has also helped us as an institution to improve ourselves. And we together need to get better and better at doing this. Thank you.
Thank you so much. Thank you so much, Dr. Pandu Harimuti from the World Bank, in sharing what the bank is working to help strengthening the health system that will impact the TB response performance in the world as well. Now I would like to provide the opportunity to Sherry Vincent from the USAID, the Chief TB Divisions.
Yeah, thank you for inviting me today, and thank you to the Minister for your action and your leadership. It's very much appreciated. And thank you for Stop TB Indonesia. And to the panelists, this is a great panel that represents the different groups that need to be involved in ending TB. The US government is very committed to ending TB. I think this week and what we've done over the past 5 years has demonstrated that. First, on new tools. The US government represents 40% of the investments in global research. And that's a big investment. And so we are committed to finding that new tool, that real point of care diagnostic. And I think collectively we're working to do that as the US government. As USAID, we've invested, thanks to Congress, $4.7 billion since 2000. And what we do is work with our partner countries to help find how to use those new innovations. What are the ways that we can do things differently? And every country is different. Every health system is different. And so working to figure out how do we use those to efficiently use them immediately, but use them within that healthcare system. And the other thing that we work is making sure that all partners are involved. Obviously, the Ministry of Health and National TB programs are leading the way and have the national strategic plans, but they can't do it alone. It's very important that we have civil society and grassroots organizations, NGOs, academia, all the partners involved to play their role. We can't end TB without all of our partners. And so I think it's really important that we continue to look at how do we work together? How do we work more collectively to be more than our individual selves, to do more than our individual dollar? Because we don't have a lot of resources in TB. I think that is something that we all know, that there are limited resources and that it's a huge burden. And so we need to stretch that dollar further. We need to do more with the resources that we have within the health systems that we have, with the partners that we have. And I thank you all today. Today, the HLM tomorrow is one moment in time. If we don't take action on what actually gets adopted tomorrow, if we don't start the next day and implement it, which will take all of us here, and many, many more people, then we won't fulfill our dream. And I know our dream all here is to end TB, and I really appreciate having the opportunity and having such esteemed ministers here as well for their commitment to this. Thank you.
Thank you so much. And next, I would like to invite Beams Gawanas, the Vice Chair of the Board Global Fund, to share your thoughts on this.
Good afternoon, Your Excellencies, colleagues, friends. First of all, I would like to thank the government of Indonesia, the Stop TB Partnership Indonesia, and the Stop TB Partnership for organizing this important event. The call to action on financing for TB response developed under Indonesia's G20 presidency last year clearly demonstrates its commitment to further accelerate much-needed investment to end TB. Indonesia's leadership in the fight against TB is truly inspiring. COVID-19 pushed our progress against TB off track in 2020 and 2021. But in 2022, we saw a notable improvement in results in the fight against TB. The Global Fund Partnership has been at the heart of this global recovery. We acted swiftly to support countries to mitigate the impact of COVID-19 on TB programs. That effort was ultimately successful, and in 2022, we put more people on TB on treatment than ever before. Since it was created in 2002, the Global Fund has disbursed $15.8 billion for TB and HIV/TB programs across more than 120 countries. The Global Fund provides the largest share, 76%, of all international financing for TB. Oh, you can't hear me.
Just move it. Yeah.
It also acts as a powerful catalyst for domestic resource mobilization through core financing requirements as well as broader advocacy and technical assistance for increased investment in health. The Global Fund is increasingly exploring innovative financing solutions to maximize our impact. For example, we supported a $300 million TB loan buy down last year with the government of Indonesia, World Bank, and the Gates Foundation. This investment will improve the coverage, quality, and efficiency of the TB response in Indonesia. Our experience has demonstrated that investments in the fight against TB are key to achieving universal health coverage and building greater pandemic preparedness. Strengthening TB programs has multiplied spillover benefits for other diseases, from lab system strengthening to community health workers and disease surveillance. The Global Fund is the world's largest multilateral provider of grants for strengthening systems for health. Over the 2021-23 implementation period, we are investing $4.9 billion in health systems through our core grants and our COVID-19 response mechanism. This includes investments in laboratory systems, which is used to fight diseases. For instance, in Indonesia, the Global Fund has invested $30 million through C19RM to purchase new equipment and train staff for 17 out of the 42 laboratories under Indonesia's Biomedical and Genome Science Initiative. The best way to achieve universal health coverage and prepare for future pandemics is by finishing the fights against preventable, treatable diseases like TB. I would like to end off and divert a little bit from what I have presented on behalf of the Global Fund and to say, investment and doing the right thing is not always about finances. The Global Fund adopted a new strategy, and the strategy is about putting community and human rights and social justice at the core of our programs. And so I think it's important that as we speak about the future and about investments into the future, that we also look at what we have today. Someone mentioned psychosocial support. What some people need, those that are suffering from TB and impacted by TB, is a recognition that they exist as human beings with equal rights like all of us. You know, when my nephew died of HIV, he lived long, and at that time, we did not have treatment. But the reason why he lived long was because we loved him. We cared for him, and he lived without the treatment. But ultimately, he passed on. So all that I always hear when communities speak to us is, let's listen to them. Let's listen and just hear what they are saying. It's important because we talk about community involvement. Don't invite the communities to the table if you don't have time to listen to them and act on what they are telling us. And so I was saying, I must end off by just being who I am. I'm not a health practitioner. I am not a financier. I am a human rights and a social justice warrior. And that is what I thought I should share personally with everyone here, and to say investment is not just money. Investment is care and reaching out and touch. Thank you.
Thank you. Thank you, Bien Sriawanas, for the very inspiring sharing today. And personally, as the head foundation of Stop TB Partnership Indonesia, we are very grateful to be the primary recipient. The Global Fund allow us to empower TB community in Indonesia to be part of the TB elimination effort. So thank you. Now I would like to invite our last discussion, never the least, Dr. Subanan Sahu, the Deputy Director from Stop TB Partnership.
Thank you, Your Excellencies and participants. One of the role of Stop TB Partnership is to bring together diverse partners in this global fight against TB. And that is what we do quite a lot. And great to see a lot of partners in this room. We also do a lot of advocacy and political commitment mobilization. You may have seen that on Tuesday this week, there was a global, there was a coalition of leaders to end TB launched with 7 countries, heads of states, who were represented by the honorable ministers. Both Indonesia and South Africa were there. So thank you, ministers, for your leadership. And we expect that this kind of leadership is required because political commitment is key. Even for investment, we need political commitment. Now, I wanted to touch upon 2 things, listening to people on the panel and the speakers today. First is urgency, and the second is investment. So let me come to urgency. I was very impressed by my friend Norbert when he said how they are testing people. Testing at scale, test. This is what we learned during COVID. And we have heard also, Minister Budi, you have some targets on testing and how to get all the people who are missing from care treated, diagnosed and treated. So I think a lot of things that we can learn from COVID and apply will get us to scale, and that kind of a testing at scale, irrespective of symptom, using digital tools. So urgency is very important because we just have, let us reflect on it, just have 7 years to end TB, 2030, that's the target. Now let me shift to investment. And I want to reflect on what the Excellency, the Foreign Affairs Minister of Indonesia said, if I heard it correctly. She said, investment in TB is investment in development. And she talked about poverty. So investment in TB is investment in development, and that too inclusive, pro-poor development. I think this is something that we need to reflect on more in the TB community in our resource mobilization efforts. I want to also touch upon what Teresa said, that in TB we don't have just one solution. You need to invest on a comprehensive investment package. And when we did the global plan to end TB, 2023 to 2030, that is the main message of the global plan, that you need to do prevention, diagnosis, treatment, and in a comprehensive package. And then TB rates will come down and we can achieve the targets. So it's very important to think about a comprehensive package of what we need to do in TB, because TB can be prevented, it can be diagnosed, it can be treated to cure, and many tools are available currently, many are in the research mode, in the pipeline coming. I want to also highlight that in the political declaration that hopefully will be endorsed on Friday, we have some targets on funding, and we must reflect on it. What does it mean? Because to reach those targets, 5 billion per year on research and development, 22 billion per year on care and prevention, what we need is increase our current funding, not small increments, but 4 to 5 times. That's the kind of thing. But we know that it's possible. Countries have shown it, and a lot of lessons learned from the countries. Indonesia has shown, and we heard also from Pandu and Global Fund, how this innovative financing was put in place. So it is possible to increase funding substantially in countries. And let me end by saying that TB is a good investment. Why? Because the return on investment is great. The global plan says that if you invest $1 in TB care and prevention, you get $40, 40 in return. And if you don't invest, the contrary, that's the cost of inaction, over the years, you could have a loss of as high as $1 trillion, not million, $1 trillion. That's the cost of inaction. So it's a good investment. It's an investment for development, pro-poor, inclusive development. I think this is the message that we need to carry forward further. Thank you.
Thank you so much, Dr. Sahu. And I think that we're at the end of the time for the discussions. And we're a little bit of time, and it always happens, I think, this week. And before I give the stage back to the Master of Ceremony, I'll just to share a little bit that all of us here, without a doubt, we agree that investment on TB are very important. And today we'll start to talk about how we can optimize our investments to end TB, because our time is always limited, our energy is always limited, our resources will always be limited. In fact, actually, when we speak with our minister about the plan to have discussion today, one thing that the minister said to me was, why do we need another event? Why not just focus on working, making sure that the delivery is happening? Because we keep talking about, creating access, delivering, but we need to focus more on the work on the ground. We need to focus on how we invest, whom are the people that we should include to make sure that the investments really make the world can end TB in 2030. So thank you so much for your time. I hope that our investment to be here today, this week, shall be reflected in our works right after, to make sure the investments to eliminate TB are done timely and properly. Thank you. Now I would like to give the
Thank you very much, Ibu Nurul, to lead this important discussion, and also thank you for all the panelists' discussions, and everyone can back to your seat now.
Do we have enough seats?
So before we proceed to the closing, I would like to invite Minister of Health South Africa, His Excellency Dr. Joe Phala, to provide a few words about how we can move onwards after the tuberculosis high-level meeting. Please, Dr. Joe, the stage is yours.
Thank you very much to our facilitators. And thanks to my friend, Mr. Budi, for organizing this event together with the government of Poland, Stop TB Partnership, I see Lushika has gone out, but thank you very much. Oh, you just came back. Okay. Thank you very much. Well, I think, I'm very optimistic about tomorrow on the high-level meeting that will approve the declaration. But over and above that, knowing that we have done this before 2018, but I think this is going to be different. Just looking, judging from the enthusiasm, the energy, the commitment, it makes me very, optimistic that after tomorrow, after this week, things are going to be different. And I'm sure Lushika will be able to take a holiday after that because I think the partnership is really, happening with all the role players. I'm really looking forward to this as being a very historic week, and that tomorrow indeed is going to be very historic, and that we can't miss the target again. That 2030 is just a few years to come, 7 years, and thank you very much to my colleague and everyone here. I think it's a very good build-up for tomorrow's session at the United Nations Assembly. Thank you very much.
Thank you very much. Thank you very much, Dr. Joe, for the very encouraging words. Now we are coming to the end of the sessions, and we are honored. We are having His Excellency Mr. Budi Gunadi Sadikin, the Minister of Health Indonesia. Please have the stage.
Ladies and gentlemen, it is. I'm sorry to Nurul because I just the first time I came to a tuberculosis meeting is with Nurul were there, and we just finished our, hit the 400 jabs in COVID-19 vaccinations. So I came to a hotel, very big event, a lot of speakers and talking about tuberculosis, and I read my paper, and I have to thank Global Fund that have given me like close to 100 million every year for the last 10 years. That's $1 billion amount of money, Then I start talking to my colleague, Pak Maksi, what is this number estimation? Oh, Pak, there is a number that the estimate by WHO with a very complex calculation that I don't understand how they come to a numbers, 845,000 potential tuberculosis patient in Indonesia, and they just increased to 969,000. And what is our achievement so far? Our achievement is 560,000-ish something. After $1 billion after 10 years contribution from Global Fund, we only reached 560,000 notification out of 969. So what happened with the rest? 400,000. But they are still there and spreading all the virus everywhere in every corner of Indonesia. So I'm a very blunt and direct person. So when I had the mic, I just said, okay. So people in Indonesia that working on TB, from now on, let's stop talking and let's stop having a meeting and start working. And then we push everyday meeting after that to get the numbers up, and then we got from 560,000 to 724,000 for the first time in history. But that is I strongly believe that there are things that we need to do. The issue in any programs or any implementations is how to execute. So execution capability is very, very important for us to do. And notwithstanding that, yes, Indonesia started involved in the new TB vaccination program with Bill and Melinda Gates for a clinical trial level 3 in Indonesia, hopefully next year. We will meet with BioNTech for the mRNA tuberculosis vaccine. We are working also with CanSino Biologics in China for viral factor vaccine also in clinical trial level 1. Because thanks to Pak Melki here, I have 2 parliament members that support me to approve the health bill that is being passed last August. Then many companies now want to do clinical trials in Indonesia. But we strongly believe that there are many things that we need to execute. And when I talk about your statement about community involvement, I think that is what I've seen in this room. So many people working together with a single purpose to end TB. So I think that is the greatest asset that you have. So yes, one, you need to execute, but then you need to execute this together. It's impossible for us if we do it alone. We have to do this together. And let me close with what I've just seen during the discussions, because I'm a little bit tired after walking around more than 15,000 steps because it's a traffic jam everywhere during the meeting. I tried to do Google and look for tuberculosis in Wikipedia. I just realized that this diseases has actually killed more than 1 billion people in the last 2 centuries. This makes tuberculosis the largest, killers of, pathogen for humanity. Yeah. And even now, they kill more than 4,000 people every day. So they are still killing people, yeah? Even after 200 years. And I tried to look for the Wikipedia and try to look when actually tuberculosis was found. So they have a chapter like, the origin of tuberculosis, the tuberculosis in early civilizations, tuberculosis in Middle Ages and Renaissance in Europe, tuberculosis in pre-Columbian America, 17th and 18th centuries, 19th century, 20th century, and then they stop, notes and references. So that means the tuberculosis has been there for thousands of years. And when I see the origin of tuberculosis is actually 6,000 years ago in Africa, when the seal migrate to America and they are spreading all the tuberculosis virus. So that has been for many, many thousands of years. So now, when I at the beginning I said, let's stop, talking, let's stop having a meeting, let's start working. Then I will put one more statement. I will make me start dreaming. So 7 years from now, or 8 years from now, I'm getting old. I will be retired next year. Will be 60. 60 in Indonesia is called a senior citizen category. So I don't know, in the next 7 years, somebody of you, young people that's sitting at the back, will become the next generation of health ministers. And one of them will stand in front of all of us like here in this room and saying, hey, 7 years ago in 2023, I listened to this guy from Indonesia telling about, stop meetings, stop, talking and start working. But at the end of the day, he mentioned that, why don't we start dreaming? Dreaming to see that the new Wikipedia on tuberculosis, yes, it will start the same thing, the origin of tuberculosis in early civilizations, and pre-Columbian American tuberculosis, Middle Ages and Renaissance European tuberculosis, 17th, 18th century, 19th century, 20th century, and there is a new chapter that I want to share with you, which is the end of TB in 2030. So thank you.
Thank you, Minister Budi, for always providing an inspiring remarks as always. So, ladies and gentlemen, we have reached the conclusion of our side event. I want to express our gratitude to all the speakers, panelists, discussants, and attendees for their active participations. We have had insightful discussions on the importance of investment in TB, and it is clear that a global collaborations and walk the talk are essential to achieve the end of TB. Once again, on behalf of Government of Indonesia, Government of Poland, Stop TB Partnerships, and Stop TB Partnership Indonesia, I would like to thank you all for joining us today, and we look forward to continued collaborations in the fight against tuberculosis. Now, before everyone is leaving, I would like to invite Minister Budi and all the panelists and discussants to have a photo sessions. Please come to up front, and committee, please helping to arrange the photo sessions.